the branches coming from the arch of aorta, and similarly from this side we will see the left subclavian. It is always important for us to see the left supraclavicular region, इधर देखें मेरी तरफ, for any lymph nodes or so. So we have seen, ऊपर देखें, the left-sided vessels, and definitely अब सीधा देखें, there are bigger lymph nodes here. Above the carotid, you can appreciate the flow inside. There you see. Okay. Now, we would like to see the chest and the pericardium. I am showing it to you on the right side. ये हाथ ऊपर कर ले. As an example, I must show you that in order to see the pleural surface through the intercostal space, we place the probe in 10 o'clock position. This is 12, this is 11, this is 10. So we normally will find the pleura. There you see the pleural surface moving up and down. This is the visceral pleura. लंबा सांस लें. There we see. निकाल दें. And there is no effusion here. In a few spaces anteriorly and also here you see the pleura. This white line is the pleura. The posterior costophrenic recess is seen again at 10 o'clock position. Here you see the liver, the dome, and above is this pleural space. So if there is any effusion, we will see here. There's the anterior costophrenic, and this is the posterior costophrenic. Now, for the heart, we will place at the lateral sternal and chondral junction. There we are. I'm enlarging the image for you. So, what we are interested here is to see any pericardial effusion. This much space we always find. You can see the space appearing here, the pericardial, at the apex here. We don't see it here, but here you can see the space, the pericardial. So between the myocardium and this pericardium, the parietal, we will see if there is any effusion. We can tilt the patient to the left as well. Probe is placed at the chondrosternal junction, lateral edge of the sternum. In thinly built individuals, we can see from below. So there you see the pericardial space, this one. ये निकाल लें तकिए आप उठे चलो मास्क भी पहन लें ऊपर बाजू पर ही there we are. So this much space is normal at the apex. This is transhepatic view. You can see the heart. All right, my dear. Before we go to the abdomen, we will see the axillae, both axillae. I'm doing it only on the right side because of the time, little time left. So there you see. Pakistani patient, and you can see lymph nodes. There we are. Axillary lymph node. These are the axillary lymph nodes. This one and this one. And look at the axillary artery and the vein. This is the artery and the vein is above. I'm pressing it to show you the flow in it. And there you see a few lymph nodes. So we are definitely going for a fine needle aspiration of one of these lymph nodes because they are everywhere. There you see the lymph node. This is the pectoralis muscle. This is how they will appear. you can appreciate the vascularity inside. So now we are going over to the abdomen, starting with the anterior abdominal wall. So, especially in females, we would like to see any hernia in the anterior abdominal wall, asymptomatic. There you see the skin, the subcutaneous fat. This is the right rectus, the left rectus. And this is the linea alba. The same I will show you with a linear probe now. The skin, the subcutaneous fat, the anterior rectus sheath, the rectus muscle, the posterior rectus sheath, the left rectus, anterior rectus sheath, and posterior. And there you see linea alba. Below linea alba, we see intraperitoneal fat here. I'm just adjusting. ठीक है, थोड़ा सा मेरी तरफ करवट लो, ना 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 करो, करवट लो और थोड़ी बस. This is how I'm going. So this is it. You see the linea alba here, the two rectus muscles on this and this left side, linea alba till we reach the umbilicus, loci. Again you see the two recti, and in the midline they are joining at the linea alba. So this is how we go. Linea alba here is very little muscles. They are adjacent to each other. You see this fat there. There we are. Going back, the umbilicus, going up. So, सीधा लेते हैं. So we have seen, ये ढीला कर लें जरा, नाले को ढीला करो, बस छोड़ दो छोड़ दो छोड़ दो. In the right iliac fossa, we go now to see any free fluid. This is the iliopsoas muscle. This is the anterior abdominal wall. And there you see intestinal loops with food particles, white food particles inside, the same layers over there. And therefore, by chance, you can appreciate this appendix, which is normal. There we are. The appendix is visible. This is the appendix going into the cecum there. This is the cecum, and there you see the appendix going in. There. So this appendix is less than or around around 5 millimeter in diameter. So let's see, from serosa to serosa, it is 4.3. So this is normal. I can make it bigger for you so that you can see the luminal line. There you see the white luminal line of the appendix. So the lumen is empty. The two opposing mucosal surfaces together will make this white line. On both sides is the mucosa. On either side, you see this submucosa, the white. Then is the proper muscle layer, muscularis propria, and then is the serosa, the white. So how many white are there? The luminar surface is white, the submucosa is white, the serosa is white. This is muscularis propria, and this black is the mucosa.